Dear friends, how are you doing today? It is always good to be with you on Gam Yachad, together during COVID-19. And I've been saying it time and time again, seeing things seem to be getting better as we hit the warmer months maybe, as more and more people may now actually have antibodies. And so we can all be more and more hopeful. But on this edition of the program, I want you to hear a discussion I had with a very special woman, Dr. Sigal Sviri. She's the director of the Medical Intensive Care Unit at Hadassah Hospital in Ein Kerem, Israel. And she gave me time to talk about how Hadassah Hospital has been treating COVID-19 patients, to talk about the extraordinary success Israel has had in keeping the numbers of fatalities way down, way below what has happened in most European countries. And I'm talking about adjusting for population size, and how she feels about the way in which, in general, we as people in society should be dealing with the problems related to COVID-19. Here's my discussion with Sigal Sviri. Sigal, thank you so much for making time for us on JBS.
Thank you very much for inviting me.
Sigal, before we talk about COVID-19 in Israel and how Hadassah Hospital has been in the forefront of caring for those with the virus, I want you to hear what high esteem I hold you and your colleagues in, all of you in the medical profession, doctors, nurses, aides, psychologists, all of you, every one of you is doing God's work. Kol hakavod to you and your entire team.
Thank you very much. Warm, kind words.
All right, Sigal, Israel seems to have done a marvelous job at containing the virus, minimizing the number of people who have died from the disease. As of the beginning of June, Israel has fewer than 300 deaths from COVID-19. And to put that in context for our audience, that would be the equivalent of some 12,000 with a population the size of the United States. 12,000 compared to the more than 100,000 fatalities in this country. And I know there are many demographic differences between Israel and America, which contribute to this significant disparity, not the least of which is population density. But I'm curious to know what you think is the main reasons, or the main reasons are, Israel has had so relatively fewer deaths than the United States and many other Western nations.
Okay, so thank you for this question. It's obviously a complicated question and a complicated answer, but I think there are several reasons for this. First of all, Israel was very early in implementing closure of the sky, but also closure of several population infrastructures, including schools, including restaurants, and other gatherings of many people together. And I must say I was surprised how compliant the population was to this. And I think some of it was because reports coming in from Italy were very scary. And we saw pictures in the media of hundreds of patients arriving to the emergency departments in Italy and Spain with high mortality. And the Ministry of Health in Israel took this very, very seriously. And we were actually asked to start getting ready to incorporate or to include COVID-19 patients into the hospital very early on well, it wasn't very early on compared to China, but it was relatively early on in February. And luckily for us in Hadassah, we were able to isolate a separate area for all the COVID-19 patients so that they were not mixed with other patients in the hospital. So very early on, we started being getting organized for admitting these complicated cases. But I think there are other reasons why Israel did so well. I think the population in Israel is younger, and I think that the community medicine is quite good. Everybody has a family physician, everybody has compulsory medical care, and most patients, even if they have chronic diseases like diabetes or hypertension, are pretty well maintained in the community. So together we received fewer elderly patients with multimorbidities, and the load on us as a medical team was lower than in other places. So we could actually treat the patients that were coming in and were not overloaded.
I understand. I have a couple of questions based on what you just said. First of all, do you remember by any chance roughly what date did Israel shut down incoming travel from China?
I can't remember. We can find out. I can't remember exactly,
All right.
but it was sometime in, I think it was February.
Okay. But wait, the Trump administration shut down travel from China to the United States on January 31st. He was criticized roundly for being xenophobic. Were there similar charges leveled at Prime Minister Netanyahu when Israel shut down travel from China?
I think China was not the major problem. I think Europe and America were bigger problems because many Israelis and Jews who wanted to come back to Israel were stuck abroad, and there was a big lobby to try and get everybody back home. And there was a lot of pressure on the Minister of the Interior and on Bibi Netanyahu to allow these Israelis and Orthodox Jews to come back to Israel. And there have been special flights to try and repatriate people who were stuck, even in South America.
Yes. By the way, America had the exact same situation where the question was, what would America do with American citizens who were outside the country? And ultimately, they were allowed to come back as well. But that doesn't answer my question as to whether there were charges in any way. Were people upset in Israel the way people were upset in the United States when travel was shut down?
I don't think so. I think that people understood very early on that flights are being cancelled out of the country and into the country. I don't remember anybody making an uproar on the fact that there are no flights, because people understood the danger of letting people in with a virus, and obviously understood that if they did leave the country and come back, they would have to be in quarantine for 2 weeks. And I remember the first few days, there was a party from South Korea who traveled all over Israel, and some of them were carrying the virus and infected one of the tour guides or the bus driver, and he was critically ill. And I think that made people understand that this disease is very dangerous.
Do you remember when you, as the head of an ICU unit at Hadassah Hospital, at what point, Sigal, do you become aware of the severity of the threat inherent in COVID-19?
I remember February, during February, people were talking around in the corridors about, oh, this is just another flu, oh, it's nothing, oh, it's just in China, it's far away. By the beginning of March, as I said before, people were watching what's happening in Europe and getting quite scared. So we at Hadassah formed a team of intensivists, of specialists in infectious diseases, who together with management started building a plan, making a plan in Hadassah to be able to deal with this. And the Ministry of Health, I must say, estimated that the number of critically ill people was going to be in the thousands, and the mortality was going to be in the thousands. And we were practically ordered by the Ministry of Health to make hundreds of beds. In each hospital in Israel had to find a place for hundreds of beds for COVID-19 patients. So everybody was very, very, very busy in the country during the beginning of March. There was one hospital who emptied a car park and made it into a hospitalization area. So hospitals were looking at what other hospitals were doing. And as I said before, Hadassah was lucky that we have a separate area that is now supposed to be renovated, but it's empty. So we could actually use that area to plan the admission of COVID-19 patients, which actually happened at the end. So beginning of March.
Okay. As you look back on it, are you surprised that so many very intelligent and knowledgeable and informed people in the medical establishment in Israel and in the United States didn't see it coming in December? Are you surprised, or do you say to yourself, there were reasons and you're not critical of your medical profession in Israel? Americans shouldn't be critical of how, at what point America begins to deal with it, and that you understand why in some way it took all of us and all of you by surprise. As you look back on it, what do you think to yourself?
China is far away, and I think people were looking back to 2003 with the SARS epidemic. It never arrived in Israel. It was in Asia and North America, but it never arrived in Israel. So people were thinking, oh, maybe we will be lucky this time as well. It's not going to get here. It's far away. And even if it does get here, it's only 1 or 2% mortality, which is not that bad. But when it started getting closer, and when it started getting into Italy, which is a relatively warmer Mediterranean country, and where when the mortality was rising towards 8, 9, and 10%, which is huge, then people started understanding that it's getting here and it's getting closer.
Okay.
But initially it looked very far away.
Yes, that's very honest. All right, so now I want to talk about the actual work you do and what it's been like in the ICU. You're the director of the ICU, the intensive care unit at Hadassah Hospital. I have heard horror stories about the peak moments of the disease in terms of doctors and nurses here in the United States, people who devote their lives to saving lives, Sigal, helpless, watching as person after person with the disease, especially those who are older, and you've already mentioned the issue of underlying health issues, but they just had to, they felt they were watching helplessly as person after person passed away. At the worst moments of this pandemic, what was it like for you in Hadassah's ICU? To what extent did you experience the similar kind of experience? Or, as Israel did better overall, was that never your experience at Hadassah?
had the advantage of building in a critical care area, which was managed by experts in critical care, doctors and nurses. And initially, as patients were coming in, we could handle the situation. We received one patient and we could treat them. We received another in the next day. So we could actually manage the situation. But at some point, we understood that the critically ill patients are getting more and more sick, and we had to open another area. And the other area, which I personally wasn't managing, but was also a critical care area, was overloaded in a few days with tens of critically ill ventilated patients. And I remember the stress of the doctors and the nurses of trying to figure out which patient is more critically ill than the other, which should get priority, which should get this kind of ventilation, which should get that kind of drug. And it was very, very, very stressful because patients were fine 1 minute talking and breathing and looking at you, and in 1 hour they were on a respirator with no oxygenation. It was extremely dramatic. But again, overall, I think that we were ready, and I think that Hadassah is special because Hadassah invests a lot of resources in training intensivists. And there are relatively a lot of intensive care beds at Hadassah and relatively a lot of intensivists at Hadassah, so we could manage. And there is another advantage that because in Israel there aren't that many intensive care beds, physicians are used to providing ventilation and critical care to patients outside of the intensive care on regular days. So we have anesthesiologists, internal medicine specialists, and residents who know how to ventilate patients outside of the ICU. So we knew that when patients would come in and would not be able to be treated in the ICU and would have to go to a ward, not an ICU, there would still be people who would be able to take care of them. And this is true to most hospitals in Israel, but Hadassah especially is the pioneer in training residents from different areas of medicine in critical care for many, many years now. So we really were lucky that we had many extra people who were trained to treat these patients.
Well, good for you. And again, kol hakavod to you at Hadassah Hospital. Were you ever overrun, Sigal?
I think there were a few days where we were getting very worried that patients would die if they don't have a monitored bed and expert care. But it didn't happen. Patients got good care, and we had an area which was able to be expanded on demand. So you could have 5 critically ill patients, 10 critically ill patients, 20 critically ill patients in one area, and you could expand it on demand. But the most important thing was to have physicians and nurses who could treat these patients outside of the regular ICUs,
Yes,
which were functioning in parallel to all of this. Nothing really stopped. So I actually had to run 2 units in parallel, my own regular unit and this one.
I
So
understand.
it was very challenging.
Yes. You must, by the way, be very proud of the people who basically you were helping to manage and direct, doctors and nurses. And unfortunately for me, I have been in hospitals many times. And in fact, I was hospitalized when on a trip to Israel and ended up in Shaarei Tzedek Hospital in Jerusalem. And I know that, first of all, you want a wonderful, superb doctor. You want somebody who knows the craft of medicine. But Sigal, I have the highest regard also for nurses. And I feel that in many ways, the doctor comes, does what the doctor does, but the agent of recovery for many patients in many situations is the nurse. And I treasure the good nurses I've had, including a wonderful nurse I had at Shaarei Tzedek, who happened to be a Palestinian Israeli. But I have the greatest regard for nurses, and my guess is you are very proud of the people, your doctors and nurses who are working in the ICU with you.
Yes, I agree with you completely. I think that if there's a very important conclusion, if we look back to the last couple of months, if you ask people who were treating COVID-19 patients, they would tell you that one of the most important aspects of care to these patients are the nurses. The nurses are there day and night, hours on end, fully protected, wearing head to toe masks and gowns and gloves and headgear. They can barely hear what's going on. They can barely see because of the mist in their eyes. They cannot have a rest for hours on end, and they take risk because they can get infected. But they treat the patients in a way that is really astonishing. And I'm so proud of them. And I'm sure that we would not have had such a big success if it weren't for the nursing staff.
Yes, they're doing God's work. Now, you said something, and it startled me in a way, and that may be just my naivete and my being not somebody in the medical world. When it was described in America, it was almost as if this is a disease that affects the respiratory system, and the body has to fight it off itself. That there isn't much that can be done, and that one can give a person oxygen. And then if it turns out it continues to progress, one can put one on a ventilator to, as you say, oxygenate better. But that ultimately the sense we had in America was either people's own immune system defeated the disease, or the disease defeated them and they died. You make it sound like quality of care had an impact on whether people died or not. Am I understanding you correctly?
Yes, this is what I think. I think that we were surprised by a virus we didn't know. We had to learn what the virus does to the body. We quickly learned that it causes things we've never seen before. It was a different virus. It was a different disease. And apart from the respiratory system, it causes clotting in different vessels. It causes a severe inflammation in the body. The body even causes an overreactive inflammation in the body, which causes damage as well. And we had to learn step by step how to treat these patients. There were no random control trials. We had no expert opinion on what works and what doesn't work. And reports were coming in as we went along. So we had to adjust.
In America, we were told that it was over 90% of people who went on a respirator died. Was it the same percentage in Israel? Was it significantly lower? What?
Absolutely not. The average, there are data coming in from different hospitals in Israel, but on average, the mortality of ventilated patients in Israel is between 25 and 40%.
Wow. Boy, that's a wow. The other thing you mentioned the word drugs. In America, there's been a lot of controversy. First of all, At Hadassah, do you know which drugs were used, and specifically, was hydroxychloroquine used at Hadassah?
From day one, hydroxychloroquine was used at Hadassah. Because we didn't know what else to give. Reports from China were coming in that suggesting that it worked. Nobody was proving it, obviously. The quality of the data was mostly descriptive and not comparative. But we really didn't know what to give. We had nothing else to give.
So what did you find? As you look back, do you feel there was any efficacy to that drug?
You know, I was thinking about this a lot during the last couple of weeks when the infectious diseases people said no more hydroxychloroquine for COVID-19 patients. So I said, okay, why? And why did we give it? And why are we not giving it anymore? There is no evidence that it worked. It may have worked in some people and it may have not made a difference in others. But the fear was that it has side effects that might cause cardiac arrhythmias and even deaths. And therefore, people didn't want to take the risk in giving a medicine that may not improve the patients, but may do harm. But I cannot absolutely answer that question in a scientific way because that's what we did, and patients did recover, but they may have recovered from the quality of care or from other things. I can tell you that one of the things that we did, not immediately, but after about a month, was to give convalescent plasma from people, that's plasma with antibodies, for people who recovered from COVID-19. And for people who were in critical condition, we did give convalescent plasma. Maybe that made the difference. Some patients also received anti-inflammatory drugs, which may also have made a difference. It's very difficult to tell under these circumstances.
Okay. Did you give remdesivir?
Unfortunately, we do not have remdesivir. Remdesivir was used as compassionate care for the first handful of patients in Israel. Then the Gilead company went into a study and stopped the compassionate use. So during the time of the study, we did not have any remdesivir. But hopefully we will be able to receive some remdesivir for future patients if there is another wave. But currently we do not have remdesivir in the hospital.
Does this suggest you think remdesivir could be an efficacious medication?
The reports coming in now from the studies that I mentioned are suggesting that it reduces the length of the illness. It doesn't obviously, it's not a magic bullet. It doesn't obviously make patients get up and walk home the next day. It shortened the illness from about 2 weeks to about 10 days, which obviously may be helpful. And I think we should be very careful in deciding when to give the drug. Not too early, if the patient obviously will recover without it, but not too late when the virus has already spread in the body. So I think in the future we will give it to patients who are going into a difficult situation.
So it sounds to me like you're not sure what you were doing in terms of medication that helped people get better. You gave hydroxychloroquine for a while, then you were told not to do it. You didn't really have remdesivir. You mentioned another drug that I have not heard of. But what you seem to be saying is that you were giving these drugs and they may have been helpful, but you can't be sure. Have I understood you correctly?
Yes, and this is the problem of working in unclear situations. It's very scary.
Yes,
you want to give something, you want to do something, but you're not sure that what you're doing actually works. This is why we have to wait for further studies that are now being completed, so that we know what to do in the next wave, because this information is critical for how we approach the disease in the future.
Okay. By the way, do you have a family of your own?
Yes, I do. I have, I'm married and I have 2 boys.
Lovely. Okay. And do you, by any chance, are any of your parents still living?
Yes, my mother is alive,
Very nice.
but she doesn't see me much because I'm too scared to visit her.
I understand 1,000%. Anyway, if someone in your family or your mother specifically ended up at Hadassah Hospital with COVID-19, I know if it were somebody I loved, I wouldn't be worried about how long they were in the hospital. I would be worried about whether they would live or die. And I would want the hospital, anybody I loved they were in, to do anything or everything which might make sure one day they walk out of that hospital. Now, that's from a lay perspective. But I'm asking you, you're a real pro here. If somebody you loved had COVID-19, would you say, I want you to try any drug necessary? Or would you say for someone you loved, no, there's a protocol at the moment, and we don't really know what hydroxychloroquine does or does not do, and maybe it causes arrhythmias and other kind of heart problems, and I don't know what this drug or that one drugs. I've heard some anecdotal information about it, but I want to know philosophically, how do you, again, as a pro, how do you approach this? It really is an existential philosophical question which can mean the difference between life and death. What's your approach, Sigal?
I'm going to say something that might surprise you, but I truly believe that every single patient that came into my unit during the COVID-19 epidemic received the best care that I could have given him, and the same care I would give my mother. I would not give a family member things that I didn't give to others, and I would not hesitate to give things that I think work. As I said before, at the moment, we would give convalescent plasma. We would give antibodies from people who are healed from COVID-19, and we would give the best critical care, monitoring, and fine-tuning, and adjustments to stabilize their organs so that they come out of this as best they can.
Oh.
But I really feel that we gave everything we could to everybody.
I'm sure you did. And I wasn't suggesting that you would give your mother better care than you're giving anyone. I was using your mother or somebody in your own family to know whether you would be more willing to use an experimental medication than at the moment general protocol in Israel permits.
I would offer them experimental medicine. I have a patient now who's also receiving experimental medicine that we haven't tried before. Obviously, he has to consent. I would offer anybody any experimental medicine that's available. But I really feel that we are educated from a very young age to treat everybody as best we can.
Of course.
And try to prevent, in Israel, death is something that you really try to prevent in extreme situations. And we prolong life in many situations where other countries may not prolong life. We are not allowed, for example, to disconnect patients from ventilators and withdraw critical therapy to their lives. So really it's a matter of philosophy, but also a deep education of our profession, and we are used to trying to find the best solution for everybody.
Again, lovely, and I am sure that you were describing absolute reality. Did any of the nurses on your ICU, in your ICU unit, come down with COVID-19?
Luckily, no.
Is that remarkable, or
Yes.
you're not surprised?
I'm surprised. I thought somebody would catch the virus, but I must say that the management of the hospital made sure that every single person, whether it's a doctor, a nurse, a physiotherapist, a dietitian, a technician of some kind, was protected from head to toe, and they actually needed to be checked. We check everybody who goes into the area before they go into the area to make sure they didn't forget anything. And I think this made it possible for us to stay safe. And the other thing is that not very early on, but it's been more than a month now that everybody walks around in the hospital with a surgical mask everywhere. Doesn't matter if they are working in the COVID area or not. Everybody wears a mask, and therefore every interaction with every patient anywhere in the hospital is with a mask. And this I think reduced exposure from people who you don't know are carriers of the disease.
In America now, we are all told if we are going out and we're going to be in proximity of other people, we are to wear masks, but not to protect ourselves, but to protect others in case we have the virus and are still non-symptomatic and therefore we don't know it. But if someone comes in contact with us, no one wants to give the disease to someone else. In other words, is there a different use of the mask in a hospital setting as opposed to the streets of Israel or the streets of New York?
I don't think so, because when my team in the unit does a ward round, I have people from different places in the country, of different age groups, of different family environments. And we protect ourselves from each other. It's not as though we protect ourselves from patients, and it's not as though we necessarily protect the patients from us. Everybody protects themselves from each other. Because if I had one person in my team who caught the virus, we would all have to be in quarantine for 2 weeks, and there would be nobody to look after the patients. So it goes both ways. You have to protect yourselves from others, patients and colleagues, and they have to protect themselves from you. And the other thing I have to mention is that in Hadassah, we have to be checked every 2 weeks for COVID-19. So all the staff members in Hadassah are checked regularly whether they're carriers of the virus or not, to
I understand.
obviously reduce exposure.
If I were on Ben Yehuda Street, or if I were in Dizengoff Square, wherever in Israel, would I see people wearing masks?
This is a trick question.
I didn't mean it. In general, are Israelis wearing masks?
Less and less, unfortunately. Less and less.
Unfortunately.
Unfortunately.
In
And
other words,
I think,
you recommend
yes,
ordinary
definitely.
people still using masks, yes?
Definitely.
Okay.
Definitely.
And when you recommend an ordinary person wearing a mask on the streets of Israel, do you recommend it in part because you believe that mask might protect them from contracting the disease from someone they come in contact with who has the disease?
Yes, it would protect them, and it would protect us from them. So it's always bidirectional. It's not just one way.
Okay, I understand what you're saying, but I want you to hear me. In America, we're not told that. We're told wear a mask, it'll protect the other guy. You're saying it's good to wear a mask, not only because you'll protect someone in the event that you have the disease, but you will be to some extent protected from someone else who may have the disease. That's
Yes.
what you're saying, correct?
Yes,
Okay.
yes, that's what I'm saying.
Okay, and by the way, I believe most Americans instinctively already have accepted your insight. I don't know why it isn't told to us as simply as you do. Now, you said fewer and fewer Israelis are wearing the mask. And one of the questions I had for you, as an director of an IC unit in Israel, do you consider this pandemic basically over for the present time?
We are concerned because opening up the schools caused another focus of spread. There have been many schools that have identified carriers of the virus.
Children?
And teenagers. Teenagers usually are asymptomatic. They don't know that they're carrying the virus, but they carry the virus and they can spread it to elderly family members or even teachers. And every day more and more schools are being shut down and all the students are being quarantined at home in the last few days because of this school outbreak. I actually at the moment have a man in the unit who's the grandfather of one of these school children who caught the virus from his granddaughter and is in critical condition. So I am concerned that the virus is not over. I'm concerned that people have taken off the measures that were implemented too quickly, and that teenage adolescents are the focus of the next spread of the virus in the next few weeks. So it's not over yet.
All right. So it's interesting though. It sounds to me like you're saying it's not over, but you're only talking about a slice of the Israeli population. You're not saying to me that you feel the coronavirus in Israel is as potent and as dangerous today as it was in March and April. Do I hear you correctly?
Yeah, it's not as bad as it was. And I think the reason is because firstly, it's a slice of the population, and teenagers don't get really very badly sick. I mean, they may feel a bit fatigued or flu-like, but I'm not worried about them in terms of being very, very sick. So the chances of them spreading the virus exist, but they're not as spread as March and April, where most of the virus was in highly populated ultra-Orthodox areas of Jerusalem and Bnei Brak, and there it spread like a fire in a field. That was amazing how fast it spread. So you're right, it's a slice of the population, and it's a healthy population.
Okay.
So they do not get that sick.
Okay. So are you worried about ending the lockdown in Israel? It's a big issue here in America. When all 50 states have begun implementing forms of ending the lockdown and letting people return to a more normal life, there's a real worry among some that there is going to be, once again, a spike that will drive the numbers sky high and that hospitals again will be overrun. To what extent do you worry about the end of the lockdown in Israel?
I think it's natural that when the lockdown is reduced, then people will get infected. This is the way it works. You let people out, they infect each other. But I think we learned a few things from the past few months. We know that elderly patients and patients with multimorbidities should stay away from highly dense areas, from youngsters, and should always wear a mask. I think that even in the schools, they should have kept wearing the masks, because if they would have kept wearing the masks, then the spread would have been reduced. So if you take the measures that are required from you to not to go to crowded areas, not to go to big parties and go wild, make sure you have a mask and that you stay about a meter or two from the next person to you, then it's okay to reduce the lockdown.
Okay. Sigal, have you been watching at all the protests that took over the United States recently?
Yes, a little bit when I
Okay.
have time.
Okay. Again, I want your professional opinion here. In America, we were told the worst thing we could do is be in close proximity to other people, even worse if we were not wearing masks. And people were prohibited from gathering together, whether in a synagogue or a barber shop, or even people were at one point forbidden to protest the lockdowns. Then suddenly there are mass protests occurring in major cities across the country where thousands of people are lumped together, mostly wearing masks, but not all wearing masks. Certainly, however, not social distancing. They're on top of each other, and they're yelling and screaming, which I understand is the way in which you spread respiratory disease if you have it. Do you expect in America, would you be surprised to see or not see a significant uptick of coronavirus cases in America in the next week to 2 weeks because of all the protests that have been going on in this country?
Yes, in areas where the protests were held in quiet, with physical distancing, with masks, no. But in areas where, as you say, there were many, many people gathered together without masks, screaming and shouting and spreading their respiratory virus all over the place, I would expect there would be an increase in the spread of the virus. Yes, definitely.
What would it mean to you if there isn't?
It would mean that many of the people who were demonstrating were probably immune to the virus already. Maybe they caught it in the previous weeks and they developed antibodies, and that there is starting to be immunization of the population, a herd immunization, what we call, that the people in the community are immune to the virus because they've been exposed.
Thousands and thousands of people in cities all over America?
No, not all of them.
If you're right, you're basically saying coronavirus is over in America.
No. I didn't mean that all of them are immune. I'm saying that the more people who are immune you have in a crowd, the less the virus can spread from one to the other. So if the usual spread is from 1 to 2 people, or 1 to 3, or 1 to 4 people, now it will be 1 to 1 or even less. And therefore, when you reduce the amount of people who can catch the virus, you reduce the spread. But also maybe the virus is changing, maybe the weather is changing, maybe the atmospheric conditions for the virus to spread are changing. And we know that viruses have waves.
Yes, and that's why I said to you, do you think it's over? if it turns out that all of these cities have thousands of people together, not social distancing, and there is not a serious uptick, it would say to me logically, basically the coronavirus is nowhere near as prevalent, present, or threatening as it was in February, March, and April, even May.
Maybe. That's a possibility. Because viruses, again, have waves.
Okay.
And that is why, based on what happened in 1918 with the Spanish virus, it came back in the winter and infected more people, but there was a break in between.
By the way, in Israel, what's the attitude about getting the virus from a surface? We seem to have been told recently that it's much less likely to get the vaccine from a surface, a doorknob, a countertop, a package that comes from Amazon, than we originally believed, and that it really is communicated person to person. What's being said in Israel?
The most important way to catch the virus is from respiratory secretions. That's true, from person to person. Droplets that are spread from one person to the other. But we know that the virus can survive on surfaces. Different types of surfaces have different lengths of contamination. Metals are different from plastics, are different from glass. So we know that metals can hold the virus for a few days, and therefore everybody talks about hand hygiene with alcohol gel, and everybody, even the children, have to go to school with alcohol gel in the bag, and they have to wipe their hands with the alcohol gel every few hours. In the hospital, we have to wear gloves and disinfect our hands all the time. And when, for example, a patient goes home and you want to send their clothes and their particulars out of the corona area, you have to wait at least a week before the virus is supposed to have been eradicated from the surface. We don't know, we don't measure, we don't take tests, but this is what is customary. You have to wait until the virus is eliminated from the surfaces, or to clean them with antiseptics.
Okay. One more question. What's your sense, Sigal, about a vaccine being developed in the near future or not?
It will be developed, but it will be available in 2021. I don't think it will be mass produced before then. Therefore, we have another winter before us, which may be a difficult winter if we have both the regular flu and the COVID-19 together. Hopefully it won't be bad, but it may be bad. But next year, I think there would be a vaccine, and we will probably get mass vaccinations in most of the world.
Is there anything else you want to say about what's going on in the ICU at Hadassah, or have we pretty much covered it?
Yes, there is something I want to say that is very, very important, and we learned this as we went along. And this is the communication between the families and the patients. And I think everybody should be aware that it's wrong to refuse family members to communicate electronically or even physically with their loved ones.
Good for you. What's been the practice at Hadassah?
So initially we were very apprehensive and nobody could walk in the corona area, and family members were calling on the phone, asking questions, and it was horrific. And then people in Israel, in Ichilov started first, but more and more hospitals allowed family members to say goodbye to patients who were dying, and they allowed them to go in. They wore protective gear, and they were allowed to comfort them at the last minute. But then we said, why just at the last minute? It's too late. Let's allow them to go in before the last minute. So at the moment, we allow family members to visit COVID-19 patients, even if they're critically ill. We dress them up. We make sure they do it properly. We escort them in, and they can spend the time with their relatives, even if they're critically ill, so that there is contact between them. And I have to tell you one story about an elderly man who was taken off the respirator on Leila Seder, and he was alone in the unit. And I started talking to him. I said, Mr. So-and-so, it's Leila Seder. Well done. You're breathing on your own again. And when he heard it's Leila Seder and he's not with his family, he just started crying. And we started crying with him. So we took the iPad. We have an iPad in the unit that was donated to us. And we made contact with his son. And his son, through the FaceTime, looked at his father and comforted him and encouraged him. And it was the most emotionally exciting thing I've seen. And obviously he did well and he went back home. But this told me that what makes the people feel that they have hope and that they can recover is contact with their families. And everybody must allow this. This is a very important message that I have to say, that we've learned the hard way, but we've learned and we made a change.
It is so wonderful to hear this from you. Do you think, by the way, this policy is now being implemented in hospitals in general in Israel, or not yet?
Yes, it's changed. It's changed because we saw that it's not the end of the world. Family members can go in and see their patients, their loved ones, and walk out, and the ceiling doesn't fall.
Yes.
Everything is okay.
Yes, and the point you're also making, and everybody understands it, so much, it's all about human contact. Sigal, it helps people get better who are going to get better. Mm. And why would you let someone pass away without having the comfort of people they love near them and around them?
Yes.
It made no sense. I understand it was out of fright. I understand. Yes. But there was something that so obviously inhumane about it. So the way you describe it is lovely. You are lovely. I adore you. I adore you. I cannot
so now
wait.
We have to meet.
I cannot wait to meet you in person. I want you to extend to everyone at Hadassah Hospital how proud we are of who you are. And I'm now talking about you in the plural. You and your colleagues, all doctors, nurses, the technicians, the aides, all of you, the social workers, the people who admit, who even worry about billing, all of you.
Yes.
You should know how proud we are as Jews of who you are. I wish you kol tuv hatzlacha. You personally, your family should stay safe and well. And if I need more, I will call you again. But thank you, Sigal.
Thank you, and it was a pleasure, and I would be happy to talk to you again and to meet you personally.
Stay
safe.
Sigal Sviri, Director of the Medical Intensive Care Unit at Hadassah Hospital in Ein Kerem. And again, she represents what a physician, what a doctor, what a nurse, what people in the medical profession are all about. As always, I'd love to hear any reactions you have to my discussion with Sigal. Please email me at rabbigolub@jbstv.org. Until the next time, I'm Mark Golub. Stay safe and be well, my friends.